Hello everyone, my name is Darleny and in the next video I'm going to tell the Unit 6 Medical Practitioner 2. A. Hospital staff. The people who work in any type of workplace, including hospital, all call it the staff. The medical staff is a British hospital belong to one of four main groups. A pre-registered house office or house officer is a newly graduate doctor in the first year of postgraduate training. After a year, he or the becomes of registered medical practitioner in the current system of training. The Foundation's program. The name for this junior doctor is Foundation Years 1 Doctors. A senior house officer is in the second year of postgraduate training. The leader of non-foundation years 2 doctor, but the old term senior house officer or CHO are still used. A specialist register is a doctor who has completed the foundation's program and is training in one of the medical specialists. There are also some non-trainees registered, doctors who have completed their training but do host with specialist yet. A consultant. It's a full quality special. There may also be some socially special senior doctors who do wish to become consultants. In addition, there is a list of medical or clinical director. He is responsible of all of the medical staff. Medical team. Consultants, physicians of surgeons are responsible of a specialist number of patients in the hospital. Each consultant has a team of junior doctors to help care for those patients. In many hospitals, there are multidisciplinary team which consists not only the doctor but also physiotherapists and their other allied professionals. When patients enter on an admit to hospital, they are usually seen first by one of the junior doctors of the ward that are will receive treatment and care. The junior doctors clear them, takes the medical history and examines. They sometimes later to register also this special and may order investigation or tests, for example, X-rays or on HCG. Made a provisional diagnostic and begin treatment, the consultant usually sees the new admissions. People who have recently been admitted to the patients is recorded with the register. Consultants also decide whether a patient is ready to be disgraded, sent home. On the ward room, the consultant is accompanied by the team and the nurse. And they visit all the patients in the consultant's care shift. Junior doctor now normally work in shift, which means that normally work in the 8 hour every day, for example, 7 or 3 p.m. and usually 7 a.m. to the next day. Exercise of the unit number 6. Make word combination using a word from each box. Look at B, C, and A opposite to help you. Associate specialist, house officer, on-call, provisional diagnostic, radio pager, word wrong. 2. Match the description 1-5 with the job letters A, E. Look at the I and B opposite to help you. 1. Dr. Grammer has been a pediatrician for 8 years and is responsible for treatment to children admitted to work. Consultant. Dr. Stewart has just started the second year of the Foundation's program. SOE. Dr. Shin are started this training as a surgeon, a specialist register. Dr. Phillips has just graduated and is working in a large hospital in Birmingham, row or house. Dr. Miller is in charge to the medical staff in the Birmingham Hospital, medical director. Number 3. Are the following statements true or false? Finish reason for your answer in A, B, and C opposite. Number 1. A medical graduate becomes registered 2 years after foundations? False. The system of training doctors is called the Foundations Program? True. The name senior house often is no longer used in Britain? True. The consultant is usually the first doctor to see new patients? False. When working in shifts, all doctors take turns to be on call? True. Number 4. Complete the text on the PROH. Describe her job. Look at A, B, and C opposite to help you. When I get to work, the first thing I do is talk to the house office who's got a duty the last shift to find out if there have been any admissions. Then I generally see to church nurses. He tells me if there's anything that needs to be done urgently. 6 intravenous lines to pour in a cup down. Later in the morning, I admit any new patients, which basically is involving talking about history. On Tuesday and Friday morning, the consultants do her warm home, and I have to make sure I'm completed to the date on their patients. After that, there are usually lots of things to do, like writing on reasons from the blood test, and so on. In the afternoon, I have to prepare for any patients to are to be discretion. The next day, they're usually happy to be going to home. And there, of course, there are the lectures and tutorials in the Foundations program on Monday and Wednesdays. Thank you.